resume our recording this morning and let's get started. Kelly, you want to start?
Good morning, everybody, and welcome to Vaccine Myth Busting Seminar. We thank you for the Health Department, the County Health Department, Beaumont, and Henry Ford for being here today. My name is Kelly Lavani, and I'm the CEO for the Macomb County Chamber of Commerce.
I also want to echo my thanks this morning. My name is Stacy Ziarko, and I'm the President and CEO of the Sterling Heights Regional Chamber of Commerce. Our health system partners and our county health department, and Kelly and I thought this was such an important topic to partner and collaborate and bring you all great information as the vaccine rollout ramps up and vaccines become more accessible. We hope that we can provide you some great information this morning. A couple housekeeping items. You are all in webinar format, so you should be on mute. And if you're not, if you could mute yourself. We will be monitoring the question and answer box throughout the course of the webinar. We did get some questions ahead of time. If we do not get to time to answer all of your questions this morning, we will share these questions with our panelists, ask them if they can provide some answers, and then share them with you after the webinar. And just an FYI, this webinar will be recorded. It is recording. I'm looking at the button that says that right now. It's the big fear factor of the morning. But we will share this with you and with our social media sites and our health system partners in the county that we can continue to share this information.
Okay, we're going to take a moment to introduce you to our panelists. Our first panelist is Dr. Joel Fishbane. He attended Washington University in St. Louis and graduated with a chemistry degree before attending St. Louis University School of Medicine. Upon graduation from medical school, he completed his internal medicine residency at Madigan Army Medical Center in Tacoma, Washington. He completed his infectious disease fellowship training from the Walter Reed Army Medical Center and retired from the U.S. Army in 2008. After 10 years of infectious disease service at Ascension at St. John's, he moved to Beaumont Grosse Pointe, where he serves as the medical director for infection prevention and continues to provide infectious disease clinical care for his inpatient and outpatients.
Fantastic. And our next panelist is Dr. Allison Weinman. She's an infectious disease physician at Henry Ford Health System and medical director of its antimicrobial stewardship program. Dr. Weinman leads the health system's immunization committee and has played a key role in Henry Ford's preparation and response to the COVID-19 pandemic. Dr. Weinman earned her medical degree from Monash University in Australia and completed additional training at Monash University and a fellowship at the Mayo Clinic. We thank you for joining us today.
And next we have Andrew Cox. Andrew is the health officer for the Macomb County Health Department. Andrew currently provides expertise on a wide variety of public health areas, including environmental health and public health emergency preparedness topics, including mass vaccinations and strategic national stockpile planning. Andrew currently has over 15 years experience in working in public health and is a registered environmental health sanitarian through the National Environment Health Association. Andrew has his master's in public health and a bachelor's in human biology from Michigan State University. We're so honored to have all of our panelists here today, and we're going to go ahead and start with Andrew as he gives an update on the COVID overview for Macomb County.
Thank you so much, Kelly and Stacy, and I appreciate the opportunity to talk to everybody, and it seems really fitting that we're doing this on really our anniversary of COVID, when our first case was determined in Macomb County and announced a year ago yesterday, or a year ago tomorrow, I should say, is our official anniversary date. So I can't help but remember all the lives that have been affected, and especially the lives that, unfortunately we lost through COVID. And then I think that's why today is so important to hopefully educate people, and if they are on the fence about getting vaccinated, that after today, hopefully they feel more confident in that decision to go ahead and get vaccinated when they're eligible to get vaccinated. So I'd like to take just a quick few minutes just to talk about what we're doing on the county level before we turn it over to our great panelists to talk about the vaccine specifically. But so far, in the county, we've taken the approach of really partnering with multiple communities. So I'm going to first talk about our mass vaccination clinic site in our Reculin building, which is in Clinton Township, kind of centrally located in the county. But this week we surpassed 70,000 doses allocated, just that site alone, which is an awesome undertaking since we started, very late in December when we got the vaccine. We began with Pfizer, and then we got Moderna, and then ultimately last week we got Johnson & Johnson, which is a game changer for all of us to have now 3 good, safe vaccines available for the public. And I'll talk about each one of those specifically. So Pfizer and Moderna, we are particularly administering out of our Reculin site. We've now since brought on different community partner sites through Richmond Lennox, which is a drive-through site. We quickly realized that, and we knew this, that to serve our most vulnerable population, the senior population, that we needed a drive-through site to assist with mobility concerns. So that has been really a great partnership that we've done with smart transportation at both of our community sites to get individuals that don't have transportation or transportation that's easily accessible, to get those individuals out to that site free of charge. So I think we're really proud of that. SMART has really stepped up to assist us, and it's a great partnership. It's just several of the partnerships that I think we can all talk about in Macomb, really positive things that are going on here. The other site is our senior center in Sterling Heights. That just stood up a few weeks ago, but they are already gotten several thousand people through that site, which is awesome. That site is being really run by all Sterling Heights personnel, so fire, EMS, along with Richmond Lennox, the EMS and the municipalities are really stepping up to provide vaccines to residents, which is great to see. We're hoping to get a few more sites up as well. That's in the mix planning, so we want to make sure that we give multiple sites to really limit barriers for people getting vaccinated. We've also partnered with our pharmacy partners. So we're partnering with Meyer Pharmacies to give vaccine to their stores. We've also been in talks with Kroger Pharmacy. We know that Rite Aid, Kroger, and Meyer now, all 3 are starting to offer more vaccines because we're starting to see more vaccines come and be allocated, which is a really good thing. We've already talked about, I think, several times about the CVS Walgreens partnership that's specifically going after congregate care and offering vaccine in our senior living facilities, which is a great thing because we talk about when we look at those, unfortunately, those fatalities, over 90% occurred in those senior populations, and so they were specifically hit hard and most vulnerable for COVID. And so we have really taken a focus, really from the start when they were eligible to get vaccinated, to focus on getting our seniors vaccinated. We know there's multiple other groups coming online, and that's a good thing. I think that shows that we're making good progress. We've got over 61% of the senior 65 plus vaccinated with at least 1 dose, so we've got them started in the county, and that's great. That's great news. I think we can really push full court press, given it's March Madness now, to really get the rest of the seniors taken care of that want to get vaccinated this month. And also vaccinate some of those other eligible individuals. Obviously healthcare providers, if any of those workers have not been vaccinated, we want to make sure that all those individuals have an opportunity to get vaccinated too. So we're looking at expanding operations. We're hoping to announce soon, a site hopefully in the south end, so we're working on those final details. But some really good things, some good partnerships that we're doing. In terms of the Johnson & Johnson vaccine, we're going to look at, we've already reached out to AAA1B and working with our Offices of Senior Services, which is where Meals on Wheels is housed, to talk about homebound individuals and seniors. So we've already started that program where we're going to go out to homebound individuals that can't get out, even with transportation assistance. So we're going to go and bring the vaccine to them in their residence. So it's something that I'm really excited about doing. We're going to do this with health department teams, strike teams, as well as EMS personnel in the community that have really stepped up to assist us with that. So that's just another way that we're looking to really address all the populations, the vulnerable populations. So I know that was a lot of information and a quick overview, but I want to give also my co-panelists opportunities to answer questions and talk as well. So I think that's a good place for me to stop. Thanks, Kelly.
Great, thank you, Andrew. And we will start with myth number 1, Stacy.
All right, so I'm going to ask Dr. Weinman this question. Is one of the 3 vaccines different or better than another?
Thank you, and thanks for the invitation to come, and thank you all for attending. And what an amazing year it's been. And you guys have suffered as much as anybody else, and we thank you for your patience and your cooperation with the governor's orders and the executive orders to make us all safer. We are so fortunate at this moment. This is the changing point which we've been waiting for when we have vaccine. We have effective vaccines, more effective than we thought they would, than we dreamed they would be, actually. So all of the vaccines, even though the Moderna and Pfizer work the same way, they're the messenger RNA, and Johnson & Johnson works a little bit differently with an adenovirus vector, all of them are safe and effective. And I know there's been a lot of chat about the Johnson & Johnson because the numbers look different. And it's really important to emphasize that these vaccines were not compared head-to-head. So they were not done, the studies were not done at the same time. There were more variants around when the Johnson & Johnson was done. And so the important thing to focus on is the results in all of them are highly effective at decreasing severe disease, hospitalization, and death. And that's really what we want to get across. So any vaccine you're offered, please grab it. They're all safe, they're all effective.
Thank you. And I think Kelly and I probably should have stated this, but we're going to alternate Dr. Fishbane and Dr. Weinman back and forth as well. And so my second question goes to Dr. Fishbane about myth number 2. We know that these were approved very, very quickly. And are these vaccines safe because of that quick approval?
Well, sort of a loaded question, but I would say that the preliminary data does suggest that they're very safe. Of course, lots of vaccines have side effects that are in excess of placebo, but the only thing I can comment is long-term side effects are to be determined. It is unlikely that we're going to see anything, but we always get concerned about medications or vaccines that when you initiate them because the FDA approves them, and then all of a sudden after post-marketing, after hundreds of thousands or millions of people receive medications or vaccines, other issues come to light. So I think it's to be determined. They appear to be safe and effective, as Dr. Weinman already said. So I think we have to trust the science currently. They're safe. You should get them. COVID is bad. Vaccine is good. And I would just stick with that and just stay tuned. We may know more about other unusual side effects later. And we have not had any RNA vaccines that I'm aware of. The Ebola, I have to research. I'm sorry, I'm not up to date on that. I apologize. But you know, these are new and they work.
Okay, Dr. Weinman, I already had COVID. Do I still need to get the vaccine? Is myth number 3.
So that's a really good question. And I'm very sad that anybody had COVID. I'm very thankful that anybody is able to ask that question. It means that they survived their COVID. We've had way too much loss. So the recommendation is really clear. Although you get some natural immunity from having had COVID and recovered, the duration of that immunity is probably not very durable. And we know that people can get reinfection, especially after about 90 days. So the recommendation is strongly that everybody should get vaccine, including folks who had COVID. And we don't check to see if people had COVID in the past, and we don't look at antibodies because they're probably going to get more durable immunity. There is a little proviso that if somebody is currently sick with COVID, they have to wait until they're clinically improved and out of their isolation so they don't infect anybody else. And they have an option to wait that 90 days if they want to. So that 90 days just means that during that first 90 days after COVID infection, it's unlikely you're going to get a second infection. However, knowing that the variants are now popping up, and we assume that most people have the wild type of COVID at the current time, there's really no advantage to waiting the 90 days, and there's no safety issue with waiting the 90 day, with not waiting the 90 days. So if I had a family member or a patient who recently had COVID, I'd encourage them to get their vaccine as soon as they can.
Okay, great, thank you. Dr. Fishbane, myth number 4, is there a live COVID virus in the vaccine?
Yes, there are no live viral particles within any of the current studied vaccines, even though the adenovirus containing vaccines are a non-replicating virus. These are pieces of viruses in the other two companies' vaccination products. So nothing replicates from a viral standpoint, such as the live virus vaccines that we do have, like mumps, measles, rubella, and the old varicella vaccine. You know, those are live viruses. There is nothing alive in these vaccines.
Fantastic. Our next myth is for Dr. Weinman. And will this vaccine impact fertility in women of childbearing age?
Yeah, I think that's a really important question. I know that's come up a lot. It's really important that folks get their information from trusted sites. So there's nothing to suggest, there's no scientific data to suggest there's any fertility issues. And I know this comes up a lot, and that truly is fake news as far as we know. I don't know of any vaccine that affects fertility. And so that is not a particular precaution. We don't need to check if somebody's pregnant. We don't need to caution people about conception. And again, I would emphasize that people should really get their information about the vaccines from trusted sites, not social media.
And Dr. Fishbane, once I get the vaccine, do I still need to follow CDC guidelines?
Yes, and that's the simple answer. Yes, please. And those guidelines, as you probably have seen within the last week, are changing. So this is a very dynamic, moving process. So if you keep in touch with the CDC guidelines, they talk about 2 weeks after the second vaccine dose or 2 to 4 weeks after the J&J vaccine, then they are starting to modify some of their recommendations about who can get together. But I would say stay tuned, because whatever I say right now, and somebody's going to watch this in a month on a recording, it could be completely different. So it's not only just the CDC, it's also local guidelines. I think we can always be more restrictive. So some maybe counties, cities, states might even have a higher transmission rate of some of the newer variants before their vaccine can be distributed. So even if the CDC says one thing, I always recommend you check your local health department rules. They may not be ready to, quote unquote, make them a little more lax. So yes, please continue to check the CDC website. The CDC website's excellent because there's information for patients in language that's easily understandable. There's information for providers. So you have lots of resources, but yes, we all pretty much believe in just following the CDC guidelines, and they do change.
Okay, Dr. Weinman, myth number 7, will this vaccine affect your DNA?
So that's really interesting. So these messenger RNAs are the ones that there's most concern about, and that's the Moderna and Pfizer vaccine. They work the same way. And messenger RNA technology is not new, and I think that's important to say. It's new to us because we haven't yet received a messenger RNA vaccine, but that technology has been around for about a decade, and it's already been used in cancer drugs. So this is not new technology. It was used for Ebola. The reasons these vaccines didn't become very prevalent is that the incidence of those diseases where it was tried faded out, so they couldn't prove that they worked. But they are highly effective, very smart vaccines. And what happens is that the messenger RNA is just a little fragment that codes for that spike protein that the vaccine's directed against. And that's injected in the case of the Moderna and Pfizer vaccines in a fat globule, because that's a very unstable piece of tissue. And so as it's injected into you, what happens is it goes into the outside part of the cell called the cytoplasm, if you remember from high school biology. And human DNA is in the middle, in the nucleus. The two never meet. They never interact with each other, and they never meet. And our bodies, this is really where the clever part comes in, we already make messenger RNA every day to make the proteins that we need to live. And so our bodies have a way of disposing of messenger RNA very quickly. It can't hang around because there's too many things hanging around, and it gets disposed of and disintegrates very quickly. So no, there is no risk to the human DNA.
Great. I think that was a great explanation on that. We hear that one a lot. Myth number 8 for Dr. Fishbane. Can you mix the Pfizer and Moderna vaccine? So if you get one the first time, can you get the other, or is it better to stay within the same brand?
It's very important to understand that research studies are done with the same vaccine. You get one, you get the other. Crossing over vaccines is not recommended because we have no science to say that it is safe or just as effective. So the studies are done with one vaccine. One vaccine should be given to the patient. The patient should get the same vaccine because that's where the science comes from. That's how the studies are done. Maybe in the future we'll know that it's okay, but as of right this moment, you should get the same vaccine because we just don't know how well your immune system is going to respond to a different vaccine that has a slightly different messenger RNA component. Those are my thoughts because we just don't know. But no, please get the same vaccine. Keep your card from the CDC to show the vaccination centers so that now we have 3, there is no mix-up.
And I'm actually going to throw in a little impromptu question. Andrew, as you go through the health department and you're distributing, has that been okay with the supply and the demand for the various brands?
Yeah, so we've seen a mix of different allocations. Now it seems to be we're getting more consistent with all 3 vaccines. So we're very good in diligence. We have experts in this area to make sure that individuals that come through our clinics are indeed getting the right second dose of either Pfizer or Moderna. And we can do that in several different ways. We can obviously look at their cards if they bring those, so hold on to those immunization cards that you get when you get your first dose. But we can also look it up. Let's say you accidentally lose it. We have the Michigan Care Improvement Registry, which is our immunization registry, where we can look up the record and tell as long as it was recorded. If it's still not in there, then we can also reach out to the provider and just verify that. So there's a lot of different ways and consistent ways that will make sure that people get the right doses at all the providers.
And I think as a caveat, I don't want people to be concerned if an error is made by some freak accident and you get the other vaccine, it probably is very safe. The issue is, will your body, respond the way it's supposed to? So I don't think it's dangerous if a accidental mistake is made. We just don't know about whether or not you've been successfully immunized. So, and I'll defer to Dr. Wyman to see if she agrees, but yeah, I'm not worried about safety, and I want to make that clear. I wouldn't freak out if you crossed over by accident.
Yeah, I completely agree. I think that, the accident should be rare. We all have safety mechanisms in place to make sure that people do get the correct dose. I would recommend when people get Pfizer, Moderna, and they have their card, take a picture of it on your cell phone because cards are easy to lose, so you have it with you all the time. But theoretically, it should work. It's just not clear how effectively it works because it was not studied that way.
Okay, great question, and thanks for sharing the safety mechanisms, Andrew.
So we do have some questions that were sent in ahead of time, and we've also been receiving some questions. I will remind our participants that if you have questions for our panelists this morning, please put those in the chat feature, and we will make sure that, or into the Q&A, I'm sorry, not the chat, the Q&A, and we will make sure that we will bring those to our panelists' attention. I'm gonna take the first one that is in the chat, or in the Q&A. But would you recommend vaccines to people with autoimmune disease? And Dr. Fishbane, you took yourself off mute the fastest, so it's like Jeopardy. So there you go, you win.
That's not fair. I was going to ask who you're asking. Okay, that's not fair. Since there is no live component to this vaccine, then it can safely be administered to people whose immune system may not be normal. I don't expect there to be any complications because of the way this vaccine is manufactured and put together. With all vaccines that are safe for the immunocompromised host or the individuals with a altered immune system, It's an issue of will you respond to it appropriately and develop immunity. So we give lots of vaccines to people with conditions that hurt their immune system. We just don't know if they're going to completely respond. I also will explain that sometimes to patients. So if we give a flu vaccine to somebody who happens to be on a medication for rheumatoid arthritis, they may not necessarily respond. They may still get pneumonia. I sometimes remember to warn patients. So it's safe to get the vaccine if your immune system's abnormal, as long as you don't have an allergy to one of the components, especially the components they call glycols, is my understanding. I'm not an allergist or immunologist. But I would just be cautious that if you have an abnormal immune system, please be aware you might not develop a completely robust and active immune response, and you should protect yourself and avoid people who have not been vaccinated or may be asymptomatic spreaders. Those are my concerns, and I think maybe Dr. Wyman can comment. Maybe in the next 6 to 12 months, we'll have more and more information about these unique subgroups. I'm sure somebody's going to study them and publish. And so I'd say stay tuned, but that's my only concern, not the safety, but the efficacy.
Yeah, I would echo that exactly. I think it's really important. It really emphasizes why we need a majority of the population immunized. It's to protect those folks that can't get immunized, or sorry, can't get full immune response. We worry about that. So that's where that herd immunity comes in. So, and autoimmune, there were a lot of folks in the autoimmune category or immunosuppressed category that participated in the clinical trials, even though they weren't specifically studied. But there was no adverse event noted in those groups. There are ongoing studies, but as far as we know, because it's not a live vaccine, it's definitely safe. The only question is how effective it is. So that's why even more impetus for people around those immunocompromised people to get vaccinated to protect their loved ones.
This was a question, and Dr. Wyman, I'm going to use you as the Jeopardy button right now. This one came in ahead of time. And is the vaccine a one-time shot for life? Do we get it yearly, and do we know yet?
So the short answer is we don't know yet. We all think that you're probably going to need booster shots along the way. We don't know how long immunity lasts for. And because you've heard so much about these variants, some of which are a little bit more resistant to the current vaccine, booster shots are already being developed. And so probably we'll need those as those variants become more prevalent. So again, really important people get immunized quickly. We're trying to race against time so those variants don't become more prevalent. Right now, we don't know how often you'll need the shot, but yes, you'll definitely need more shots at some point.
Can I add on to that? One of my biggest concerns is the concept of vaccination, and now I can relax all my precautions. I'm a huge proponent of monitoring for the fall and winter of next year, and strongly recommend that unless we have good data about longevity of vaccination and protection, I'm still a huge fan of masking voluntarily. I don't want to get into the politics and the mandates, but look at our flu and our other respiratory viruses, they're non-existent. So until we have more data, please do not throw your masks away. Pay attention to your local health departments and CDC. They work. So until we know about longevity, need for boosters, development of booster vaccinations, these things can come back with a vengeance. I'm very concerned about that, especially with the variants. So try not to get out of your mind safety precautions, the idea that masking certain times of year may be helpful anyway. And I'm just going to throw that plug out there.
Yeah, I would just add to that this group has a special role in that because you have businesses and you control who comes into your business and under what circumstances. So no shirt, no shoes, no mask, no service would be my recommendation. We're all immunized. We wear a mask every time we're outside, when we're with people outside our pod. So that really needs to be emphasized because, again, none of us want to see another surge in COVID. And we are very worried about that occurring, especially in states that have given up a mask mandate. So it's really on individual responsibility. In Michigan, we don't have, that hasn't been relaxed yet. But I would urge you have a strong voice here to influence people.
If I just want to jump in real quick is there an efficacy for the double masking? I see some people doing the double mask. Is that recommended, or are we just kind of supporting just a mask in general?
Yeah. So all the different cloth masks have not been studied in the way that the surgical masks have been studied. So certainly, if you're wearing a mask that you can see through, that's way too thin. so the virus can get through. So double masking probably is a good idea to do if you can, or a thicker mask where you can't see through the weave. We don't encourage the gaiters, just mask, and it has to be well fitting around the side of your face and the upper part of your face. So it's best to have the wire in, so you can, not the wire, the little steel thing, so you can compress it, and you can, the fit is really important. So sometimes double masking also helps with the fit, because the virus can get in any which way to your nose and mouth and your eyes. So really important to make sure that you're as protected as you can be.
Okay, great.
I'll just add from the health department's perspective, and I think it goes back to Dr. Fishbane's comment about community spread. Interestingly enough, talking about non-COVID related illnesses, communicable disease like influenza, our numbers are significantly down across the board this year. And that's not just by coincidence. It's because we're doing the effective measures, the public health measures, washing our hands, masking up, social distancing, why those numbers are down and effective. So I 100% agree that just because we're 100% vaccinated, we cannot, throw out all these protective measures that we've been doing a great job of. We got to continue those. And there's other benefits outside of just COVID in terms of disease spread.
Great, thank you. We're going to go ahead and jump into our question and answer and see if we can take a question from there. We'll start with the vaccine can interfere with mammography images. Is this a myth or a fact?
Are you asking anyone in particular?
Whoever wants the Jeopardy, as Stacy had said.
Well, I'll take it, and Joel can comment if he wants. So what happens is that when you get immunized, you get a local immune response. Often that's why people get a sore arm, and the local lymph nodes, which are under your arm, can get a little inflamed, which is a good thing. It means your immune system is turned on. And sometimes on a mammogram, those lymph nodes, that's also where the breast can drain. So that can be a little bit confusing. So there's been a couple of recommendations for mammograms that I've seen. One is to wait a few weeks, 4 to 6 weeks, until you have a mammogram. The other one is to make sure if you need a mammogram urgently, you shouldn't put it off, but you should just let your healthcare provider know that you received a vaccine recently and which arm you received it in. You can get swelling on both sides.
Okay, thank you.
This question came in ahead of time, and again, whoever wants to jump in first, and it says, do people with antibodies become vulnerable of getting COVID in the days after receiving the vaccine while their immune system is working?
Yes, so it's interesting. If you look at the way the RNA vaccines were studied, they looked for symptomatic people after the first dose and after the second dose. And there certainly are people who get infected after the first dose and a few who get infected after the second dose. So until your immune system becomes completely, quote unquote, immune to the virus, yes, and that is exactly how they do the studies. They want to see how effective is the vaccine, and they're lower after the first dose for the mRNA and better after the second dose. What's interesting about the J&J vaccine, when I quickly reviewed it, was that it actually may take a little longer, but its efficacy gets better and better by the 28-day period. But that's how you do the studies. Let's talk about a little bit of a more important question, and I think it's TBD at this point, and that is how many people get asymptomatic infections? Because when I looked for this, they weren't randomly swabbing people to see if they had asymptomatic infections. In all of the studies, they were only looking for symptomatic infections confirmed. But I know they're going back and they're going to start looking at that issue. And that is a big concern for us. Imagine a group of family members all getting vaccinated, and a week later they say, yay, and they throw away their masks, and somebody goes to work and comes back with asymptomatic spread. So we don't know how many people can still spread it and for how long after first dose, second dose, and that will be determined, I hope. But for now, assume you can still get infected. I have a number of patients in the hospital who got dose 1 and came in with symptomatic infection. So once you get your second dose of RNA vaccine or J&J, count to 2 weeks at least, be cautious and be aware nothing is 100% effective, and we might be able to get infected and transiently transmit it. And until we know that, please follow the protective guidelines with masking and social distancing until we have better science. And again, all of these things are going to take time, Nobody has ever developed a vaccine within 12 months and administered it to millions of people. I mean, we should be very proud of the way this progressed, but lots and lots of questions are going to be determined, and I apologize for that. But this is pretty unique and pretty amazing. So please be patient and follow the CDC guidelines.
Great. I'm actually going to combine two questions that we got together. One of them says, I'm 47 years old. Is it realistic that I will be eligible for the vaccine by May, as recently discussed by the White House? And a complementary kind of question was, what's the best way to encourage people to get vaccinated that are generally skeptical? So I think those can kind of go together.
Yeah, I'll start, and then I'll let my co-panelists finish too. But I think these are great questions, and I think I'll start with the second part first. To encourage people to get vaccinated, I think things like this webinar right here is how we do that. We have experts that are scientists and talk about data. We want to be sure that we present factual information to individuals to encourage them to have that conversation. I've done several town halls, and there's a lot of myths around vaccinations and vaccines in general, but especially around COVID vaccination. There's a lot of people that are skeptical, a lot of people that want to wait and see. We hope that by answering some of these questions about what we do and what we don't know, we'll make them more confident in making that decision to get vaccinated. I think it's also having conversations with our families and friends about getting vaccinated and sharing that, that you do feel like you've gotten vaccinated and it wasn't terrible. You didn't have severe reactions. I'm not saying that can't happen, but for the majority of people, there are very mild reactions that are occurring. Site pain in the injection site, or fever, or things like that. So I think just educating people and getting the word out. In terms of the first question, do I think the vaccine will be available like the White House announcement said? I do. I'm optimistic about that. I'm seeing less and less demand in some of the other priority groups that we've moved through. I think we're making really good progress. We're seeing vaccine supply increase, which is the number one thing. And I'm seeing providers come on board. We talked about those partnerships. Our hospital partners have been vaccinating along with us, but now we're starting to see pharmacy partners come on board. And I'm hoping that also private provider offices, urgent cares, physician offices can get the vaccine, because that's more distribution of the vaccine. All that is happening right now. And so that's why I'm pretty confident that that is reasonable, and I'm optimistic that everyone will indeed be eligible. Now, can I say everyone's going to be vaccinated by May? No, but I do think everyone's going to be eligible and have an opportunity to get vaccinated by May.
Andrew, I'm going to kind of follow up to that, because I have a couple questions on accessibility and eligibility, and there's a couple in the chat as well. So I'm going to kind of combine these on, one of the questions here says, why are we extending eligibility to younger adults when seniors aren't vaccinated? And then the second question was about special needs population that are when can we expect to see special needs population moved up in the schedule for 16 and older? And then the third piece to that is about Macomb County food service workers, and where do they fall into this? So if you can kind of look at eligibility and where people might fall in the thought process kind of from an overall standpoint, I think that could answer a lot of these.
Yeah, and it's a really great question. We always want to try to follow what the State Health Department and DHHS guidance for eligibility, because it's important that we try to stay somewhat coordinated in our efforts, because what we don't want to have happen is that Macomb County residents go over to Wayne County to get vaccinated because they're eligible there, but they're not here. That provides a lot of different logistical problems. And so we want to do this in a coordinated approach, and really from a risk perspective of healthcare workers. So why healthcare workers were, they're frontline essential workers that were at a higher risk. And also they are the ones taking care of elderly and seniors. So when we talk about caregivers and healthcare workers, those are often people that are taking care. And we saw, when we look at the nursing home, cases and infections, A lot of that was due to, the staff becoming symptomatic and spreading asymptomatic spread through the residents. So that's why we want to make sure that potentially younger people that are in those priority groups also get vaccinated, so we don't have community spread that way. And so as we move, we're looking at the different prioritization groups. The goal is to give everyone a chance to get vaccinated, but obviously there's not enough vaccine to do that, so we have to start with those priority groups and work our way through. I do think I'm seeing and hearing things about different groups becoming eligible very shortly and soon, even next week potentially, looking at disabled individuals from 16 to 49 becoming eligible here in the county. So I think we're going to see those groups really rapidly be open and eligible for the vaccine. I don't know if I answered all three questions in that, but let me know if I didn't.
I think it helps to know the eligibility, just from an overall perspective, because a lot of these were very specific, but, knowing that May 1st deadline's that May 1st target's looking very, very promising too helps.
For sure. And our most recent group was obviously the 50 plus group with underlying medical conditions and disabilities. Were eligible to get vaccinated on the 8th. All 50 plus individuals will be eligible on the 22nd, as well as caregivers of special needs, children with special needs are eligible right now as well.
There's a question in the, oh, go ahead. Go ahead, Andrew.
I just remembered the food worker.
Thank you.
So the state specifically said agriculture workers and food workers and processing because of numerous outbreaks that were traced back to those industries. I do expect that frontline food workers like restaurants and grocery store workers will very shortly here be eligible as well. I can't give you exact date, but I would expect that to occur pretty soon.
As we're talking about eligibility, one of the questions in the chat is about people that are still trying to get vaccinated that are not able to. Do you recommend a process or a access point that they should be targeting?
I think there's some really good developments. Vaccinefinder.org is a great site that is really working to have eligible options for getting vaccinated. Obviously, if they want to go to our Macomb Gov Vaccine Central page, we list several opportunities there. We know there are several different lists. We encourage people, whoever you can get vaccinated from, to get vaccinated. I know it's meaning that you're on multiple lists, but we want to share. We want to get people vaccinated as soon as possible. So it's not that you have to only be on our list or Henry Ford's or Beaumont's list. I think we all encourage everyone to try and get vaccinated wherever they can.
Yeah, I think all the healthcare systems have a way to access, even if you're not our patient, for example, you can go to henryford.com and you can register for medical record number and sign up for MyChart and get on one of our lists. But I'm sure all the other healthcare systems, and Joel probably would want to comment, have accessibility. And I would encourage people that are looking, even though I agree there'll be a lot more vaccine, we've been promised by the end of March, available. It doesn't hurt to get on multiple lists.
Great, thank you. Do you want me to keep asking, Stacy, or do you have some more? Okay. One of the questions are, why are the case numbers in Michigan climbing recently despite more people being vaccinated and mask compliance being pretty high in the state? I know in the last 2 days, Andrew, I've been following the numbers. We've seen the numbers spike again a little bit.
Yeah, I think there's several factors here in play. We've seen recently more activities being open. We've seen restaurants being open, which I full support your restaurants, but it is something of concern in terms of spread. We've also seen schools go back in person. We've seen several cases linked to sports and athletics. I love sports, but we have definitely seen associated cases with basketball, hockey, those types of sports, contact sports, which is why they were one of the last to really be open at all. I think that is part of it. Also, we've just recently seen the B117 variant, UK variant pop up. We've got 9 cases here that we've identified in Macomb County. That doesn't mean that that's it. That just means that those are the ones that were sampled and identified. We do have now our first case of the South African variant in Jackson County in a child. So I think all those factors are playing into the cases potentially going up. But I think I will say I'm significantly concerned about spring break coming up with travel. Every time we see a heavy travel period, we see increase in cases. So not that I want to discourage people from enjoying themselves and travel. I would love to travel myself, but that's just the fact and the reality that those typically will lead to additional increases in cases.
Thank you, Andrew.
So Kelly, I do have another question, and I'm not sure who would like to take this one. But can someone explain the controversy that some religious-based institutions have had with the Johnson & Johnson vaccine?
Sorry, I don't know.
Well, yeah, I can take that. I know the Pope has commented and some of the archdioceses. So a lot of vaccines are developed in an embryonic cell line, but it's very far removed from the actual vaccine that goes into arms. So it's at the very beginning of developmental stages. And so in the past, we have a lot of religious organizations have, if that's the only vaccine, have given exemptions. And I know the papal statement and the archdiocese have basically said, listen, if you have a choice, because J&J does use that technology, as do some of the others, you should probably opt away from the J&J vaccine. Having said that, it's really clear that the Catholic Church is looking at folks getting immunized, right? Patient safety. So they're saying, if you have a choice. Right now, we're not in a position, we have scarce vaccine. So the recommendation is clearly to get any vaccine you can. And again, I would refer people who are religious to look at the papal statement. There is a recommendation that safety come first and you should get any vaccine. But if you have a preference, and right now people don't have a preference, you have to get what you get, then in the future, you may be able to opt out of one of the vaccines.
Great, thank you. Okay, I'm going to try this question. It's pretty technical, so bear with me it's pretty long too. What about the piece of the spike protein that can create a non-neutralizing antibody, which can lead to antibody-dependent enhancement, allowing mRNA to replicate on its own to create spike proteins that may bind onto our reverse transcriptase enzymes? Something to do with the Y, FAB, and FAC segment, resulting in damage to our type 2 macrophages, I think, so that they cannot function on our behalf. Please explain how the Trojan horse mechanism can result from this.
Well, you want me to try?
Justice.
Okay, I'll give it a try, and I reserve all final comment for Dr. Wyman. How's that? She'll be my gatekeeper. So let's start with the basic issue. The only known issue with inappropriate antibody development that enhances second infection that I'm aware of is dengue fever. It's the classic example of a vaccine that was tried, and they have a quadrivalent. There are 4 types of dengue. If you get one dengue fever and then 6 to 7 years later a different strain comes through your country, that's when you get hemorrhagic fever, because the antibodies that you have from the first infection are enhancing. So a lot of this came from dengue as an example of one infection in the same organism leading to an enhanced second infection. As far as coronaviruses, I am unaware that that is an issue. And as far as the mRNA and the development of a spike protein antibody, the studies did not use an anti-spike protein study for geometric mean antibody titers or how much antibody did your study subject develop after vaccine. Those were neutralizing tests that most of us actually don't use in clinical care. It's becoming available, but most of us are not recommending that you get a different kind of antibody test, such as the neutralizing. So the vaccines were developed against the protein. Yes, that's true, but the antibody response in the studies was done using neutralizing antibodies. And as was already discussed, certain viruses are RNA viruses that also carry with them the appropriate enzymes to convert the RNA to DNA and then integrate it into your own human DNA. That does exist in nature. It does not exist in the vaccine. So as Dr. Wyman really very eloquently described, messenger RNA goes into the cytoplasm, or the liquid of the cell, never gets into the nucleus, and your body is loaded with mRNA, RNA ACEs. And the RNA ACEs is what destroys it. So you get your protein production and then your body destroys the RNA. I used to do research with RNA and DNA and fellowship, and I will tell you that you have to wear gloves because everything has RNA ACEs, which is why it has to be kept at -70 and why you have to wear gloves. You have to have a clean room. RNA is exquisitely susceptible to degradation in the body and outside the body. So there is and should not be any concern for integration of any of these genetic components into your own human genome, because you don't have the appropriate enzymes to do that, and the vaccine does not carry the appropriate enzymes to do that. That's long-winded. I apologize if there's any confusion. I can clarify, but that's the nutshell.
Great explanation, Joel.
Another question from the Q&A is, are there other companies, or do you anticipate additional companies developing a fourth or fifth vaccine?
I think there are altogether 7 worldwide right now, and I think I don't know what's going to happen in the future. I think some of the companies are going to combine and ask permission to make some of the vaccine. So I think as long as we have safe and effective vaccines, I think the issue is how to get them out there. I don't think we need more vaccines necessarily that work different ways. I just think we need lots of vaccine that we know works.
Yeah, I think I heard on NPR this week driving in that there are actually countries requesting a waiver of patent so that their own industries can make the same vaccine. As far as I'm concerned, just from a philosophical standpoint, that makes more sense than companies trying to do development and patent their own and try to get the studies done. It seems to me to make much more sense to have public-private partnerships that then can generate the vaccines that are proven locally in their own countries with their own companies, as long as the product can be validated against the standard product. That seems to make much more sense than having companies trying to compete for the almighty dollar pie. So those are my thoughts, and I would support the whole patent thing, but that's above and beyond my pay grade, but I thought I would comment.
Do you want me to do the next question? Stacy, keep going? Or you
Yeah, keep going, Kelly. I'm done, so you can
Okay.
keep going with the 2 that are left.
Okay. It is unknown the autoimmune problems that can result long-term from this vaccine, since mRNA has not been used before. Why are long-time FDA-approved medications such as ivermectin and hydroxychloroquine not more widely approved in the medical arena for the treatment of COVID?
Want me to take this? Is that okay, Allison? Okay. So, the problem is that the hydroxychloroquine, well, first of all, autoimmunity is unlikely because I don't know of any mimicry. So typically with any infection or vaccination that you then develop an autoimmune reaction, it's usually mimicry. You have particles in your body that cross-react with the development of immunity to the vaccine or even infection. It's well described with multiple viral infections. So then if you're talking about, so the RNA is unlikely. I'm assuming that the scientists have picked the genetic material to be selective for the spike protein, and it seems unlikely. Now, remember that we have 4 circulating coronaviruses that cause the common cold. We know that you get reinfected over and over, and anybody who has school-age children at home knows that the average number of colds that you have a year is 5, and most of those are probably coronaviruses. So we do have multiple viral infections. It's uncommon to have an autoimmune infection develop. The other part of the question, oh, it's gone already. What was it? Sorry.
I think we could go Give me one.
It was autoimmunity, and then there was
Oh, the
The
medications.
medication.
Oh, so-
Medications and the usage.
yeah. So hydroxychloroquine was very sexy because apparently in the test tube in Vero cells it had a lot of activity against coronavirus. The problem is that's a test tube, and so the data is very clear now in human subjects that the hydroxychloroquine really didn't work. The ivermectin is fascinating. You know, most of us have used a ton of ivermectin for things like scabies, and I've seen strongyloidiasis, you know, these kind of parasitic diseases. And yes, the anti-parasitic drug has been around a long time. The problem is if you look at the studies, it's fascinating. Most of them are done in foreign countries where strongyloides is common. Most of the studies were done with a combination of treatments. So trying to tease out that the ivermectin was the magic bullet, not the doxycycline that they were also given, not the steroids, et cetera, et cetera. So they were small studies. They're not what I would call sufficient science to suggest it. And as far as I'm concerned, when you're looking at viruses, you should have an antiviral specific drug. And none of these agents are specific to the virus. They may have an impact on some of the immune response to the virus. But in general, if you want to attack a virus, you need to develop an antiviral specific drug. Everything else is sort of circumstantial surrogacy and other issues. So the steroids work because it works against the inflammatory response. So yes, we really need good antiviral drugs, but now we have vaccine. I probably would just say, stay off the social media. I trust the science that the ivermectin and hydroxychloroquine really don't work. And those of us that used a boatload of hydroxychloroquine can tell you it's the steroids. But that's kind of a long-winded answer. I apologize, but that's my answer.
Yeah, I agree totally. I'm sorry.
No, I was just saying that was very informative.
Yeah, I think it's important to remember that all drugs have side effects and toxicities, and a lot of them are severe, and even though they're rare. So I think it's important that we just don't throw things at folks. If things were scientifically validated, none of us would have any issue using drugs, even if they have significant side effects and toxicities, but none of these have been scientifically proven to work. What has been scientifically proven to work are the steroids, and to a lesser extent, remdesivir, which is being widely used. So when patients come into the hospital, those are the treatments they get, as well as lots of supportive care. But I think it is, really sexy. People say, well, this is a cure, this is a cure. Well, obviously, if there was a cure, we would all be using it. So the data, it's really important, again, to follow the science. And the science, even though it looked promising in the test tube, as Joel said, did not pan out clinically.
Thank you. Yeah, I think, we hear a lot in social media, as you said, and even in the news about new drugs being tested, and then you don't hear. So then there's that unknown. So why isn't this being used? And of course, we all know this has been a very political virus too. So I think all that plays a role. So it's really helpful to get some of this good factual information. Our last question, which is perfect because we're just about out of time, is it safe for individuals who have been fully vaccinated to travel by plane?
I can start. Right now there are still travel restrictions in place, and I think that's a good thing. I mean, travel is definitely a way that variants spread. We know how this virus spreads. It's not a mystery. It's a lot of people breathing together. That's really what it is. And if you're traveling, there are ways to make that safer. But again, anytime you're outside your own pod, even if you're immunized, your risk goes up just that bit. And if you're in an airport, if you're in a plane, if you're in transit, you're at increased risk because you're with lots of people outside your pod. And it's hard to maintain social distancing and masking when you're on a plane, right? So people need to drink, to hydrate, etc. So at some point that mask needs to come down. So those are the risks. And so right now I think the CDC is wise in restricting travel. I think people need to be especially cautious in places such as yours, like restaurants. Indoors, definitely not as safe as outdoors. And I think there are ways that we can, and social distancing, very important. But again, there have been outbreaks associated with restaurants indoors because it all depends on airflow, etc. So, I think there are lots of ways that individuals can support restaurants by ordering takeout, picking up, eating outside, socially distanced, etc., without putting themselves at risk. So sure, vaccine makes you safer, but it doesn't make you safe.
Great answer. Well, we reached our time this morning. I cannot thank, Dr. Weinman, Dr. Fishbane, and Andrew enough for this. It was very informative. Kelly and I have been working on this for a couple weeks, so I felt like we knew the answers, and you still gave us, great information that we can share as well. You all brought up good points about continuing to wear masks and be safe. And I read a study the other day that said that 90% of people were going to continue hand washing when this is over. And I decided that I didn't want to make friends with the other 10% because I didn't know why they weren't going to continue washing their hands. But I think this was great information to keep us all safe and to help our communities be safer too. So Kelly, I don't know if you want to have the last word.
No, I agree with you 100%. It's been very informative. We had great questions from our audience. So thank you for those who submitted questions. Thank you for spending your valuable time to address those myths. I think we've all learned a great deal today.
Appreciate the invitation. Thank you very much.
Thanks. It's been fun. Appreciate it.
Have a great weekend, everyone. Happy Friday.
Bye.